To floss or not to floss, that genuinely is the question that's been on all of our teeth all week, let alone our lips. But as you can see, I take great care of... Well, they're not mine, are they?
You do floss, though, don't you?
Yeah, I do. Oh, I've got a little contraption we've got on here.
Yeah.
I love it. And when you give me a bit of jip, I'll give you a in your
I
face.
just use the standard floss, but I only do it at night time, so we need to find out whether that's right or
Yeah,
not.
but has it all been a waste of time? Singing dentist Dr. Milad Shadrooh joins us now. Dr. Shadrooh, thank you so much for coming in.
Thanks for having me.
Big fan of your videos, I've got to
Thank
say.
you.
I understand you've prepared a little song for us. We're going to do that in a minute.
Yeah, OK.
But I've got to ask you straight up, flossing, have I been wasting my time?
No, you haven't. Basically, we know that interdental cleaning, so cleaning in between your teeth, has to still be part of your oral hygiene routine. Flossing is just one method of doing it. So what we would recommend is, if you've got the space, if you've got the gaps, the interdental brushes are a better way of removing the plaque, the food debris and things. So if you can get one of the brushes in, that's the way to do it. But there's going to be people that just can't put the brush between their teeth. They don't have enough gaps.
My teeth are really tight.
Exactly.
Hence
So
why I floss, because if
that's
I did
exactly
it, the
right.
plaque
So
would be...
then the recommendation is floss. So it's not completely a waste of time. It just has to be patient-specific.
But this is what I say, you say it's got to be patient-specific because, you know, you go to the dentist and it's very easy to go out and get floss, it's very easy to go and get out these interdental brushes now, but they're, like I can see on your... There are so many different contraptions, like machines, like little people running around in your mouth. Like, there's so much. Sometimes it's too much, and that's why a lot of people, like, I know you know, especially, you just go for the floss.
Yeah, I mean, I go to the hygienist and they always try to sell me these interdental pieces and they just don't fit through my teeth, and they make me bleed, but then apparently you shouldn't worry about the blood because that's normal at first, but...
Well, it depends. So if there's inflammation already established, then yes, you will get a little bit of bleeding while you're getting rid of that inflammation, but then that should soon stop once it's done. But the interdentals, again, it's the technique. Same with flossing, though. You know, if you don't floss well, you can cause more damage.
Yeah.
If you're using the incorrect size, so that's the danger, as you quite rightly said. People just go out, buy whatever they can, and then
like
it's just the
floss
wrong
needs
thing.
to be rough, though. I know that sounds stupid, but you know floss is really smooth.
Yeah.
I feel like I want it to be a bit bitty, so it's...
Oh,
I
yeah,
can feel it giving it a scrub. Yeah, I like it hard in the veneer.
But maybe you just can't feel it in your veneer.
Maybe I can't feel it.
You can't feel anything.
Maybe I can't feel
Because
it.
they're not real, are they? So would you actually... Can you actually feel what...
Yeah, of course I can feel what I'm doing. Like, it's in my mouth, Dan. It's not around the corner.
But I would never say that floss needs to be rough.
I feel like I want it...
Nah, you don't want it too, no, you don't want gritty.
Oh, I'd like a bit of grit.
Oh, a bit of grit.
I'd like a bit of grit. But you know, it's not just flossing. Flossing? It's not just flossing, it's brushing.
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 Yes.
See,
OK.
this is another thing. It's like, do we, at this angle, 480... I feel like I've got to be Carol Vorderman to brush my teeth.
You need to use a protractor, first of all.
Yeah, that's what I'm saying.
What's a protractor?
The thing that does angles.
That was a joke. A joke.
Sorry.
Well, why are you bringing Carol Vorderman into brushing?
So, brushing. OK, that's the first thing to get right. Interdental brushing, yes, it's important, but if you're not doing the brushing correctly in the first place, you're already losing. So you've got to get that right. And there's different ways of doing it. Electric brushes, manual brushes. Electric brushes are better because they can help do some of the work for you. You just have to make sure you're holding it in the right place and you're guiding it correctly.
This is the thing, people say 45-degree angles.
I agree.
I've been to a dentist before that said no, straight on and side to side.
Yeah, 45 degrees is where I live. So basically, if I demonstrate with this manual brush, so basically what you want to do...
Oh, you got me old teeth.
Yeah.
Nice. I kept them knocking about.
I found them outside. So, yeah, you want to get the brush. Basically, you want to start at one corner, work your way round, and get it at about 45 degrees. So it's up towards the gum, not flat on the gum. And then just give it a very small wiggle. A little bit back and forward, just a bit, you're massaging.
And it's about 30 seconds per quarter.
Exactly, yeah. 30 seconds on the outside, and then you come back on yourself on the inside.
The problem I have with this is the 2 times you brush your teeth, morning and night, is the standard. You should brush your teeth twice a day.
Indeed.
Like, in the morning, you're generally rushing because you've got to get out the door to work, and then at night time, you want to get to bed because you've got to be up early. So it's just taking...
2 minutes.
I know, but it just feels like
find
an
the 2
effort.
minutes, because if you lose your teeth, then you're going to have way more problems.
Well, you just get new ones.
No, you could. No.
Sorry, no, you can't.
But then you still got to clean those.
So it is 2 minutes.
Exactly, yeah.
And 30 seconds per quarter.
30
so
seconds.
Top left, top right, bottom left, bottom right.
Yeah, or you can do 30 seconds, do all the outside and the top, go inside, 30 seconds back.
Right.
Go to the bottom and repeat,
But you
maintaining that angle.
I find with my electric toothbrush, so I've got like an electric one, and I feel it's got a thing on it that says when I'm going too hard. So like red light comes on, it's like you're brushing too hard. But I feel that's normal to brush that hard.
No.
Yeah.
So basically, you know, we do get the people that brush their teeth like they're cleaning off last night's dried off spag bowl. You don't want to do that.
No.
If you're scrubbing too hard, you're going to cause damage. Hence, I can show on this lovely ripe peach.
Go on the peach.
So, go on, look at that. Oh, Jesus.
So that's like a gum.
Oh, my
Imagine
Lord.
that's a
Look
gum.
what's
Look at
happened.
that.
Look what you've done to your gums.
No.
Not good.
You
Look.
don't want your gum pouring out, do you?
You don't. No, so you really don't need to brush hard. You have to do it gently and you're massaging.
And them electric toothbrushes, like I said, are really, really good.
They are good. And also they've got timers on them, so you know you've done it for the
we
full
have a
2
timer.
minutes. And it takes away a lot of that movement for you. So you just need to hold it still, get the angle right, and just gently guide it along the teeth.
And quickly going back to the flossing as well, I just
Yes.
want to talk about this.
Okay.
Because I
You like
absolutely swear by this.
Yes.
I think it's amazing because sometimes, like
Yeah,
I said,
floss.
with the floss, I feel like I need it to be a bit more rougher.
me give it a go.
But with
You've made
this,
that.
it literally just shoots everything through.
Should we demonstrate?
Yeah.
So basically, if we turn it on, there's a liquid in here, so you can use cold water, warm water if you're too sensitive, or mouthwash.
I use mouthwash.
Perfect, very good.
I'm
So,
quite scared of this.
and then you get the nozzle, you basically line it up between the teeth and
There you go.
give it a buzz.
Lovely.
Yeah,
and it
in the
shoots
face.
all the
Shoots through. Yeah.
gristle through.
That's it. So the recommendations are still, look, interdental brushes, that's the gold standard. Get the right size, this is what you should be using. If you can't put these in, go for some floss. If you still can't do that and you don't have the dexterity for it, you know, older patients, arthritis, that kind of stuff, just don't have the coordination even, then this is going to be better than
And
nothing.
how much does that cost?
About 70 quid, I think.
Yeah, you can pick them up for about that. I think
about
they're about
60.
100-ish
Yeah.
retail, but then they, you know, you can,
Oh, look
you can
out for it
find
on
them.
special.
Is
Yeah,
that
that's
actually
it.
better than floss, though, that machine? would
Well,
you
no,
say?
if you floss correctly,
Yeah.
then that
Stick
is
with
still
that.
the way to go. But, you know, like you said, you don't have the time. This thing's easier to grab for it, quickly buzz.
Yeah.
So it's better than doing nothing, for sure.
So